Social distancing measures in light of the pandemic are being eased to make way for a new normal about a year and 9 months since Korea's first COVID-19 infection. For more on the country's exit strategy, I have Professor David Kwak from Soonchang University. Professor Kwak, welcome back.
Good afternoon, Sunny.
I also have Dr. Kim Seung-taek from Institute Pasteur, Korea. Dr. Kim, good to see you again.
Good afternoon.
Right then, Professor Kwak, Korea's first set of pandemic-related restrictions were imposed exactly 611 days ago. And today we are starting our phased return into a new normal. What are your thoughts?
Well, kind of obviously, I have mixed feelings. I'm both excited as an individual citizen to finally take a step, something that's going out of the pandemic era and going into the new phase, possibly living with Corona. I would hope that this step would make the economy go back to normalcy, have everyone happy, and live healthily, obviously. But as a medical doctor, I still have to be worried because these easier restriction guidelines would obviously mean many more people will come into one place and come together, possibly exposing them to further infections and whatnot. So we should probably expect to see more confirmation cases as the government is already anticipating. But I dearly hope that that won't increase the numbers of people who are having severe diseases from it, and also the mortality rate will relatively stay low. But this also means that it's an era that we have to really look after ourselves. It means that for those people, especially with underlying diseases and immune weakening issues, they would have to be extra careful, still keeping very strict those social distancing guidelines. But for others as well who are actually going back to their work or who are going to more of in-face situations rather than before, they should also look after themselves, and for others, still keep a very strict social distancing guidelines as well.
Right, so we have to be careful. Dr. Kim, my colleagues who I mentioned earlier, the authorities here, are expecting the daily tally to hit as high as perhaps even 6,000 or 10,000 cases as we begin our transition into a new normal. Do you share this outlook?
Well, I can't tell the exactly numbers as the confirmed cases for now, but it's one of just the possibility. And then the key thing when we actually transition into some just a phase one, this sort of just living with COVID-19, is that sort of just slowing down the spreading of the viruses. That's the key issue. Otherwise, we are actually the numbers just easily overwhelm the number of our healthcare facility. So then that is the issue, and then there is just a number of variables that might just affect the number of confirmed cases as well. Like we actually discussed maybe earlier, we are actually approaching to winter. This is winter, and then this is typically the season of it's actually we observed many respiratory viral infections, such as now the coronavirus, but also the influenza virus as well. And then there was actually last weekend we also see a lot of people outside in the Halloween a party. And then that also, this kind of things that actually can be determined by our own responses. So that our response to these viruses will determine by basically the number of confirmed cases, and also the kind of a capacity that you can actually deal with.
I see. So ease measures also leads to, I suppose, a greater sense of responsibility on members of the public.
Yeah, right.
Professor Kwak, our exit strategy consists of 3 stages with an interval of 6 weeks between each stage. Is this an adequate interval in your view?
Well, personally, I think 6 weeks is good enough, given that they would have 4 weeks of trial and implementation of the new social distancing guidelines, and then 2 weeks to review that retrospectively very thoroughly, hopefully. I don't think the nature of the virus is that it changes over time in a month of calculation of the period. Meaning, if we take a month to implement it and have 2 weeks to really review it, it doesn't really matter, because if there was to be a massive cluster infection, that'll probably happen within a couple of weeks or so, especially with the Delta variant that we're having that's transmitting much faster than before. So I think giving it about 4 weeks of implementation period is sufficient in my thinking, and also 2 weeks to review it thoroughly before going ahead with the further steps, I think is appropriate.
What are your thoughts on the expanded number of people for social gatherings, Professor Kwok?
That's a particular issue that I'm kind of worried about. When they expanded the number to 12 people or 10 people possibly in the metropolitan to gather together at a time, I'm not concerned about that too much. But they've started allowing up to 99 people or 499 people to gather for a conferences or religious gatherings and whatnot. That could possibly become a source of cluster infection or possibly massive cluster infection. I'm not saying they should limit it or they should restrict it, but they should at least give them much harsher warning that if people were to gather in even larger numbers, there is greater chance, especially in a confined space, for a super spreader to happen and end up in a very big manner of confirmation cases. Maybe, as I have been saying numerous times before, they should probably also come up with a physical method to approach this, meaning for those places that have, let's say, hundreds of people or 500 of people, they should mandate them to open their windows completely, 100%, and every time that they meet. So I think still that they should take into deeper consideration of these physical aspects of transmission of the virus.
Right. Meanwhile, Dr. Kim, unvaccinated people have the option of submitting a negative PCR test to access some venues. Now, it takes about a day for the result of a PCR test, which is why some people are urging for the adoption of simpler and quicker testing methods. What are your thoughts on this?
Well, basically, there are just two main methods, but so far we have used only just the RT-PCR-based method, which is actually very good. I mean, in terms of sensitivity, sometimes that method actually detects the RNA after some broken the viruses. So what I mean is, even after there is no just infectious viruses, the RT-PCR method can detect some remaining the RNA fragments. So it is very sensitive. But on the other hand, the some rapid just antigen test, this is basically just detecting the viral protein. So in terms of sensitivity, it is way just lower sensitivity compared to RT-PCR. But then there was some study, not in Korea, but in the US, and that not all the rapid antigen tests, but some the rapid antigen test shows that if it is just if it shows some positive test, which means it actually very well correlates with the contagiousness of the some infected person. So in that case, maybe some replacing the RT-PCR with the some rapid antigen test might be just another just option we can just think about. And actually one of the best thing, I mean the better thing with the rapid antigen test, as that name implies, we can actually get the result right in the testing the facility, or just we can just test by ourselves. But then one of the caveat is that depending on how we can actually collect the samples, that actually affect the result, whether it is positive or negative. If it is just collect the samples very poor manner, it just turns out to be a negative. Although those person can be positive and also can transmit the viruses from him or herself to other people. So there's some pros and cons at this moment.
Right, and one con would be the false negative that the test could lead to.
Right.
I see. Now, beyond national borders, Singapore was perhaps one of the first countries in Asia to declare a gradual shift in strategy against COVID-19 this past summer. While authorities there are still learning to live with COVID-19, and for more on those efforts, I have Professor Paul Tambaya at the National University of Singapore live on the line. Professor, thank you for being with us.
Hi, how are you?
Fine, thank you, Professor. I'll start off by asking you about this. There was a bit of a scare this last Wednesday, that is, when Singapore reported a jump of over 5,000 new infections. Now, have authorities, Professor Tambaya, shared with the public the reason for this sudden surge in daily infections?
Well, they haven't, and it's actually a small blip. You know, we've been having consistently 3,000, 3,005 cases a day. But this actually represents a small proportion of the actual new cases, because the majority of healthy young people are doing the rapid antigen tests at home. And they're staying at home, quarantining themselves. And this is what essentially living with the virus is all about. If you're sick, you go and see a doctor. If you're well, you test yourself, you stay at home. Interestingly enough, we're using tests developed in Korea, and they work pretty well, I think.
I see. Professor Tambaya, Singapore's vaccination rate stands at above 80%, and the wearing of face masks, do correct me if I'm wrong, is mandatory there. How do you explain the resurgence in cases then?
Well, unfortunately, this resurgence in cases illustrates the limitations of non-pharmaceutical interventions, such as the mask mandates or social restrictions. But the vaccination rate, what it has done is it has kept the number of severe cases down. So even though we have several thousand new cases every day, we've got less than 24 new patients ending up in the intensive care unit. And we've had between 10 and 20 deaths from COVID-related complications every day. So again, that's what living with the virus is looking like for us. Large numbers of new cases, but mainly mild illnesses.
That is good to know, though. One essential aspect, Professor Tambaya, of learning to live with COVID-19, as you mentioned, is keeping track, of course, of the related death toll and cases of severe illnesses. How is Singapore once again then doing on that front?
Yeah, so we are keeping track of severe illnesses, deaths, intensive care utilization, just like I heard earlier that you are doing in Korea. And part of the reason is that unfortunately the current vaccines do not prevent transmission or infection as a whole, but they are highly effective at preventing severe illness. Now, people are still thinking about the daily case number because that's what they've been thinking about for the last year and a half. But slowly but surely, we're coming around to the idea that we're going to have large numbers of cases, but what really matters is that people are not dying from the disease or ending up in intensive care.
Right. Professor Tambaya, what's your take on efforts to further boost Singapore's public inoculation rate as part of efforts to better contain the resurgence there?
Yeah, so frankly, I don't think that boosting the vaccination rate is going to contain the resurgence. What it will do is it will reduce the number of severe illnesses and deaths. And our vaccination rate is pretty good. The 84% actually represents the whole population. So it includes children who are not eligible for vaccination. Amongst adults, our vaccination rate is way over at 90%. So I think, while it's good to try and catch the last few individuals who haven't been vaccinated, I think we also want to be careful about alienating some of them through some of the policies.
Right, and talking about alienating some of the members of the public, Professor Tambaya, I understand that starting January, workplaces in Singapore will ban the entry of unvaccinated people. How is the public responding to this upcoming measure, and how are authorities preparing to address concerns that you mentioned over discrimination against those unvaccinated?
Well, the vast majority of people think that this is a good idea because they don't like the idea of people getting sick and ending up in the intensive care unit and straining the healthcare system. But we have a significant vocal minority of individuals who are very concerned for a variety of reasons, some good, some not so good, about the vaccines. And personally, I think that it's better to persuade them rather than to resort to punitive measures. The authorities have given some options, like, for example, if you genuinely have a medical exemption, you can be exempted from some of these vaccination requirements. Or if you just don't want to get vaccinated, then you have to do a PCR test within 24 hours of going into work or going into a public place where vaccination is required.
And finally, Professor Tambaya, what words of advice would you care to share with Korea as it begins its journey into a new normal starting on this Monday?
Well, I think, some of the things have gone right in Singapore, like, for example, rolling out widespread rapid antigen testing, doing away with quarantines. But some of them have been a little bit confusing with the social restrictions. I like the way you've got 3 phases. I think that's a good idea. So, you have to have certain cutoffs at which point you go ahead and press on, despite the rising number of mild cases. And so it's really important not to get hung up on the number of mild cases, but to focus on the strain on the healthcare system, to learn to identify cases early, make sure everyone is treated appropriately, and eventually we get back to normal.
All right, Professor Tambaya, hopefully that will be the case. Thank you very much for your time and your thoughts.
Thank you.
Right then, Dr. Kim, back here in the studio, based on what Professor Tambaya has shared with us about the situation in Singapore, what do you propose to better contain a possible resurgence in daily infections amid our plans to ensure a new normal in the future?
Well, still, I believe the number one, just the strategy is to just more vaccination. Where according to what we actually just broadcasted earlier, the first shot was actually it's the first shot just vaccination. First vaccination actually completed about just 80% of the total population. But the second shot, which means just completing just vaccination now just about just 75%. So achieving just 80% would be just very important. And also, but I think just achieving more than 80% is probably it's not going to be very easy. I mean, just practically. So in that, just we need to just first vaccination, and then as we just see more of vaccination, we will see more of just the breakthrough infections as well. So then I think further, I just want to just emphasize there are some personal just quarantine guidelines, especially some distancing and also some mask wearing. Still, just very good advice for just to slow down just further just spreading of the viruses.
Dr. Kim, staying with the importance about vaccination, we have been told that more than 1 million people in the ages above 60, that is,
Right.
here in Korea,
Right.
remain unvaccinated. What efforts do you perhaps propose to encourage those members to get vaccinated? Are we doing enough?
Maybe there's no enough. I mean, there's still just the thing that we can do just to pursue more. And first of all is about just for that people above the 60 ages, and then there's we also always talking about the risk and the benefit for those just a group of people. Benefits is much more outweigh than the risk. So that there's nothing to lose in those cases. Even just the adverse side effects from the vaccination is less just common in those age groups. So it is highly just advisable to get vaccinated for those people.
Right. Professor Kwak, should the occupancy rate within ICU units hit 75%, authorities here have vowed to put into place a circuit breaker. Now, initially, that rate had not been 75%, but 80%. Why do you suppose was the rate lowered?
Well, to the best of my knowledge, there's no set of calculation that can predict exactly at what percentage we should make a halt to this plan, and it'll just suddenly give us enough space in the medical sector to provide service again. I believe that it originally set at 80%. The government probably started thinking about the momentum after that they put on a halt to this plan, that the momentum of the transmission of the virus will still carry on to further fill up the medical sector. That's probably why they set it down to 75% of the capacity to begin the halting of the plan, so that even if it's filled even further, they would have at least a little more buffering space, still will be able to provide to other people. I think it's not such a bad idea that they have a plan to halt the plan, but I think the more important thing is that for the whole nation, people should not come into situations where we panic about rising numbers, even if that means there's a rising number in ICU beds. So I think the government probably should start educating people that this has already been anticipated by the responsible party, and that they're going to be able to take care after us, even if the ICU beds are filling up, and also maybe even if we could see a slightly rise mortality as well.
Professor Kwak, my colleague Suo earlier mentioned that 55% of our ICU beds are currently available for COVID-19 patients. Does that put us in safe territory in your view?
Well, that personally, I just heard at that news as well, and I was kind of concerned because 55% deducted from 75%, it means we only have 20% left in the ICU bed capacity. But let's also remind ourselves, these ICU beds and mortality rates, they usually tend to rise not just a week after certain cluster infections as the confirmation numbers do, but rather it takes people several weeks of progression into the disease before sadly dying, or possibly at least a week to or more than a week to become more severe from the disease. So I think the current number that we're looking at from the ICU beds is not really truly representative of the case or transmission that are currently happening. So, which gives us a little grimmer picture in the future, because what we can possibly face going into the next week because we've had higher average daily confirmation cases through the last week and the week before, it is quite deducible that we might be even seeing further higher rise in the ICU bed fill up as well.
In the days ahead then. Meanwhile, authorities here have pre-purchased COVID-19 pills for potential treatment of 400,000 individuals here in the country. Is this enough?
Well, obviously it's not enough. And then personally, I think if some drug can be some sort of just a game changer in this just a pandemic, it has to be the orally available drug, like the molnupiravir with that. And then also it has to be administered to the very early stage of the disease, which means so then it's some very mild COVID-19. So then we can actually just block the transition into the severe COVID-19, because those are one of the main reasons why there's we need more healthcare persons and also facility to just housing all those severe COVID-19 patients. And then the third one is also the drug has to be just easily accessed, which means there's some cost issues and also some production issues. But thankfully, the Merck has just announced that maybe just molnupiravir, once it is just approved for use, those the drugs at least probably some just available with a very low cost at least some low-income countries. And as far as I know, it just probably close to some 100 countries also right now. But I'm not sure just Korea is just one of them. Probably not. But then but in addition to this cost issue, there's some production issues. So then they just securing those full amount, for example, more than 10 million doses, maybe not quite available at this time. So I think practically what the government will pursue is that if the government will use those drugs in the patients with some mild COVID-19, but with some higher risk factors, and then probably some unvaccinated high risk factors.
Right. Also, Professor Kwak, come November 22nd, the academic arena will be fully open to students here. What are your thoughts on the timing of this opening, especially in light of the relatively low vaccination rate among school children?
That's actually exactly what I was going to mention in regards to this issue. I'm quite worried about the decision to make all these students go back to school openly is because these are the specific age group that was not mandated to receive the inoculation, number one. Number two, some of the groups actually weren't even provided the inoculation, so they have quite a possibility to become super spreaders if they come into contact with infected people. Let alone, even in the past, we've had cluster infections happen from school atmosphere and school environment, probably because these are a specific age group that are not quite controllable or socially speaking as adults. So if these kids were to actually go to certain places or certain institutions after school, mingle for themselves socially, we have no way of really taking control of them despite not having inoculated them already. And let's all remember that they obviously would have all these family members, even possibly elderly members in their family. Once they go home, unvaccinated person, infected person can possibly spread to as many people as they come into contact with. I'm less worried about much younger children, however, from those kids who are newly born to, let's say, 12 years of age. They have, even if they get the disease, they're much likely to have it much milder. But for the people who are teenage years to, let's say, adult years of age, they could be treated as a regular adult per se, in a social situation, and quite likely so in the progression of disease as well. So we have to give it much deeper thought how we would handle this situation in the medical regimen, treatment regimen, as well as the preventive method as in vaccination as well.
Right, well, prevention is the best answer here, so hopefully more kids will get vaccinated in the near future.
I hope so.
All right, Professor Kwak, as always, thank you very much for your thoughts, and Dr. Kim, thank you very much for being here today.